Good afternoon, everyone. My name is Brett Klein with Eisenhower Health in the Public Relations Department. I'm excited for our lecture tonight. This is our cardiology lecture series, and so we have Lydia Vincent and Captain Carp here from CAL FIRE to walk us through stuff, and they'll talk a little bit more about everything, but a few housekeeping items as we get started. Everyone has been admitted into the room, and we'll continue to add folks as they join. Please note that you are muted, and please keep your mute on until the end of the lecture, and then we'll open it up for live Q&A. During the time, we are in recording mode, so it does not record anything unless you speak, so hold that till the end, and we'll turn the recording off. And should you have a question or things that you would like to put into the chat feature, please use that. And then as we go along, if there's something immediate or we have a break, I will ask those questions until we get to the end. And then again, we'll open it up at the end. So with that in mind, I'm going to turn it over directly to Lydia, and she'll introduce herself and the captain, and then we'll get moving. Thank you all for joining us.
Thank you for joining. This is our lecture on early heart attack care, or EHAC, and hands-only CPR. I'm Lydia Vincent, RN, chest pain coordinator at Eisenhower Medical Center.
My name is Fire Captain Justin Carp. I'm a paramedic with the CAL FIRE Riverside County Fire Department out of the Indian Wells Station.
And we're so happy to be partnering with CAL FIRE to bring you this information. In the event that Captain Carp leaves, he is still on duty. So if that happens, I apologize in advance. And this is our first time presenting together. So this is exciting for us, but it is our first time together.
Yep. Thanks for having us. Early heart attack care.
So what do we know about heart attacks? It's the #1 killer of the adult population in the United States. 735,000 Americans have heart attacks every year. About 500,000+ are a first heart attack, and 200,000+ have already had a heart attack before. And about half of those people are unaware or they don't act on the early warning signs, which is why we want to talk to you today about early heart attack care.
Heart attack symptoms.
We have a variety of things that could be symptoms of a heart attack. Some of them you may be familiar with, some of them you may not, but back pain, above the navel pain, anxiety, toothache, jaw discomfort, unexplained arm pain, dizziness or altered mental status, of course, chest pain, palpitations, diaphoresis, indigestion or feeling full, shortness of breath, excessive fatigue or weakness, and the worst of cardiac arrest.
Heart attack symptoms continuing. Specific heart attack symptoms.
The more common is chest discomfort, chest pressure, chest burning, chest fullness.
And non-specific heart attack symptoms
Are more like weakness, sweating, nausea, dizziness. The mild symptoms may also indicate the onset of a heart attack. They may come and go for hours or days before the chest pain becomes severe. But when treated early, prevention can take place to avert sudden death and cardiac damage.
Can I reduce my heart attack risk? Sorry, the mute button was covered.
Sorry. Yes, absolutely. You can reduce your heart attack risk. Learn the risk factors and modify your lifestyle to reduce the chances of heart disease. Risk factors include high blood pressure, overweight or obese, sedentary lifestyle, using tobacco products, metabolic disease, diabetes, or other illnesses. And for women, it can also include birth control pills or history of preeclampsia, gestational diabetes, or having a low birth weight, childbirth.
Hold on. What causes a heart attack and why do people die?
Oh, thank you. The heart is a great pump and needs a steady blood supply to survive. There's 3 major blood vessels that supply it, and when a blockage occurs, it interferes with the blood supply. This damages the pump and can lead to heart damage or death.
What causes a blockage?
Atherosclerosis, or hardening of the vessels. Risk factors include hypertension, cholesterol, cigarette smoking, And over time, the cholesterol plaque buildup will rupture, which allows a clot to form, and the vessel closes.
So why is there chest pain?
Well, the plaque builds up in the arteries. And you can see here on this little picture here, we have some plaque buildup. The plaque tears away or ruptures. And then to repair this, the body forms a clot to heal the tear. The clot gets bigger and blocks blood flow, and the heart muscle begins to die. And if you see on this picture, you can see some gray area of this heart muscle, and that's just an example of dead tissue there that was not getting good blood supply.
Can heart attack symptoms be different for men versus women?
Yes, absolutely. Men may feel symptoms on the left chest and arm. Women may complain of pain on the right side. Women may experience exhaustion, feeling drained, dizzy, or nauseous. Women may feel upper back pain traveling to their jaw, and women may think their stomach pain is the flu, heartburn, or an ulcer. And other signs include pain that spreads to the jaw, or difficulty or labored breathing. Obviously, anyone can have different symptoms, but women seem to have accompanying symptoms with their chest pain more often than the men do. So we don't want you to ignore this because you think you have the flu or just heartburn.
So what are the types or stages of heart attacks, and how can I help?
So there's 3 presentations of heart attack. There's the heart attack that stops you dead in your tracks. The CPR scene, obviously, you need to call 911, begin CPR, push hard, push fast. 2 steps to save a life here: call 911, push hard and fast in the center of the chest. And we're going to have a video later on about hands-only CPR for those that are not certified in BLS or comfortable doing mouth-to-mouth. Then we have the heart attack where early damage is taking place. Patient may experience that classic elephant sitting on his chest. Again, call 911, keep the patient calm. And then there's the heart attack that's just beginning. And EHAC, or early heart attack care, is very beneficial. There may be minimal symptoms. There's going to be maximal denial of symptoms by the patients. And these are the most difficult to get someone to seek medical care.
Is there a secret to getting someone medical care?
The first responder or bystander must understand the time to help the patient is in the beginning stages. Be prepared to be persistent with the patient to get checked out in the emergency room. And it's important to be proactive and heart smart. Timely action can solve the problem. Can't see Brett, I'm so sorry.
Oh, no worries. Why is denial such an important part of the heart attack problem?
Well, it's common for people to deny their symptoms. It's part of our lifestyle. We forget about ourselves sometimes. We think we're indestructible. And sometimes we only face reality when we are taken to our knees.
How can I help someone?
You help people every day. We want our viewers here in the community to know that a patient's status can change very quickly from conscious to unconscious. So it's important for you to learn CPR, also understand how to use an AED if there's one available, and always call 911.
Dr. Bahr's final advice?
Yes, so Dr. Bahr developed the EHAC program through the ACC, the Deputy Heart Attack EHAC program. And he says that when he asked people if they were to develop a blockage in a heart vessel, what stage would they prefer to experience this in? And people always choose early care. Remember, response and recognition saves lives. And that's the message that we want to get out today. I review a lot of chest pain patients, and I can tell you that only about 30% of them are calling 911. And unfortunately, sometimes people have cardiac arrest in their car on the way to the hospital. So we don't want that to happen to you. I'm sure you see the same, Captain Carp.
Absolutely.
This is a video on early heart attack.
Why do we say EHAC saves lives? Think of EHAC as a life hack. EHAC, or early heart attack care, is an educational program that saves hearts. Did you know that heart attacks may have beginnings? We call these the early signs and symptoms. Did you know that some people may have a higher chance of having a heart attack? We call these risk factors. Did you know that emergency services and ambulances have the capabilities to save your heart. This is why we ask you to call 911. Did you know that it can be hard to convince someone to call 911? We do, and we share these life-saving scenarios. The EHAC education course provides all of this information to help you recognize and respond to save a heart. So take the course today and learn this valuable life hack. And remember, when in doubt, call 911 because EHAC saves lives.
And that link there, that was the website that was shared, is where you can actually go, and it's going to review a lot of the same information that we've reviewed here, and you can print out your certification. And the next video is going to be on hands-only CPR. So pay attention to that if you ever need.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start Hands-Only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
All right, thank you for joining our presentation today. And thank you, Captain Carp. I don't know if there's any questions or if anybody wants to share an experience about early heart attack care. I know we have a lot of hometown heroes. I call hometown hero someone who has performed CPR on someone prior to EMS arriving. And I've witnessed that a lot. I'm sure you have too, and it does make a difference.
Fantastic. Well, thank you, everyone. Happy holidays to everyone, and be safe out there. And the holidays can be very stressful, so please do think what is taking place within your environment, within your body, and do not hesitate to call 911 or to have someone else in your proximity call 911 on your behalf. All right, with that in mind, we just wish everybody a safe and happy holiday and New Year. Thank you so much for joining us.
Thank you, guys.
Thank you.